Good morning, dear colleagues around Europe. It's a pleasure for me to make a statement on my experiences from Finland in this conference, very important issue as such. From Finland, there have been several experts participating in the activities of CHRODIS Plus, and that has given us an opportunity to also share the views and experiences from there. Myself, I have been involved in CHRODIS Plus by being a member of EU Commission steering group on promotion and prevention of chronic diseases, which is like an umbrella organization taking care that good or best practices are selected and disseminated around the member states of the EU. And there the CHRODIS activities have been discussed several times, and we have also been consulted by the CHRODIS activities. From Finland, the National Institute for Health and Wellbeing have been in a key role, and you are going to hear more about the activities rather soon in the next sessions. I have a couple of PowerPoint slides which I would like to share with you as a background, so to give more structure on what I'm going to speak. So just a moment, I'll open the presentation. Just shortly about the history, as I started already, that for us, promotion of health, disease prevention and health in all policies have been a very long-term way of activities. And we have got a lot of good experiences, for example, improvements in life expectancy for a long time. And but also there are a lot of challenges for us in Finland as in other countries. For example, some chronic diseases and disabilities are increasing, which makes that there are challenges for health services and long-term care. And one which is a big problem is that growing inequity is, like in other countries as well, a problem. We have done a lot of on that area, but still there's a lot of to do. And especially, I would like to mention that just now the COVID-19 situation have made some problems on that area as well. So the inequity is increasing, and that's the big challenge for us. And it's very much to do with low level of education and the distribution of different risk factors and lifestyles, as you all know about the NCD situation. And if we are thinking about the role of health promotion and disease prevention in Finland, especially when thinking about the broader health strategies, our current government, its program is including a lot of targets on objectives concerning health and equity, but they are a little bit scattered around there, but however, it's included there. I want to mention especially two issues from there. One is the reform of social and healthcare, which we have been planning for several years already. But there, the health promotion is very strongly included as a role of local level authorities, but also the regional authorities, which will be launched by the reform. And we have a very good basis there because the promotion of well-being and health have been the legislative duty of local authorities since 2010 already, and we are building on that activity. So it has been a unique situation in Finland. Some other countries also have this approach, for example, Norway. Another issue which is based on the government's program is the just new government resolution on promoting of well-being, health and safety by year 2030. And there are long-term measures included for reducing inequities. And that's something which we think it's a very good basis for activities on all sectors. We have a so-called advisory board for public health, which is guiding, directing, and monitoring implementation of a resolution. And there are members from all ministries. So we have this health in all policies approach very strongly included in the implementation of a government resolution. And of course, the role of municipalities, NGOs, and private sector are important, and other actors as well. But what could be taken as a message from our experience is that for going forward and making changes in a sustainable way, you need to have a long-term vision, long-term policies and measures, and also permanent structures and resources. Resources meaning personnel, but also money, so that you can implement these long-term vision objectives. But this gives us a very good basis for thinking about future of health promotion and disease prevention in Finland. And in a way, as was just mentioned in the recommendations of CHRODIS Plus, it's important to align existing strategies, which we are doing by the government resolution. So not build silos, but try to work together with different programs, different strategies, and different activities. And also, it's important to have this health in all policies approach, which is to have intersectoral action and use all the tools and measures, methods which you have developed, and use there also evidence. So this is very, very strongly what you have taken up already in the recommendation, and that's something which is very valuable. I would then like to continue with economic well-being, which is very much based on health in all policies approach, which we have had in Finland, which we launched especially already 2006 when we hold the previous Finnish presidency of the EU Council. And now last autumn we prepared these council conclusions on economic well-being, and this is something which is giving a policy orientation and government's approach to put people and their well-being at the center of policy and decision making. So a horizontal and holistic approach, which in an EU context creates opportunity to have all the policy areas included and also have influence on the health and well-being of people. And that's not just for EU, but also the member states. And that's something which is perhaps also creating more practical tools and more practical approaches on the areas of education, social protection, equality, healthcare, etc. And such way giving support for all the member states also on a national level implement this approach. And that's something which we are now also thinking to take forward in Finland. And there especially the knowledge base is very important. So that we need to know and understand health situation, well-being indicators, and also all the determinants of them. What kind of activities there could be to influence this and have such kind of activities which are effective and also as part of not just activities but also policies related to health and well-being and safety of people. So, but thinking about the CHRODIS Plus, it's not just the knowledge base which we need there. Also, we need to transfer and implement good practices in an effective way. And therefore, CHRODIS Plus, for example, is a very good and has had an important role in promoting the implementation of policies and practices that have been demonstrated to be successful. And then one more approach to economic well-being or promotion of health and well-being of people. We are just now living in the COVID-19 situation, which is seems to be going to not so good direction, and very much there is like a big challenge for us for the future. What our economies and our societies in the future will look like. So the crisis have highlighted very much the link between well-being, health, and the economy, and therefore it could also create opportunities for us to make sustainable recovery policies, resilience policies, and also on European level, but also on national level, so that it's not just the economy which is in a crisis situation, but taking into account at the same time the well-being of people and economic problems and economic situation. We can go further to planning the future, not just the problems of today, but also the future for long term, how to recover from this situation. And there we need impact assessment of legislation and policy initiatives on well-being, and also include the field of economic policy. So myself, I think this is something which could create good opportunities for us to take long-term measures to promote well-being and reduce inequity, which has been increasing in this COVID-19 situation, not just look at the situation of today. And especially of thinking about chronic diseases, there have been developed several good ways to handle the situation by COVID-19. And these tools and activities and methods which have been developed should be now taken into account and taken into practice, implementation. For example, all the digital tools which are one of the major innovation during the COVID-19 is something we should utilize very well. And then to end with what we have learned from CHRODIS Plus, there's a lot of activities which have been going on already in Finland, but there's a lot of also which we have learned or taken forward by participating in the CHRODIS Plus. For example, current recommendations on providing lifestyle counseling are such that have been used as a basis for the CHRODIS Plus work. And already before there was now one of them on unhealthy diet and insufficient physical activity, but before also on smoking. And I want to mention also the OECD. This is assessing cost effectiveness of good practices. So it's good to have cooperation with different actors. And what have we learned? That still health in all policies and economic well-being approaches are useful while thinking what to do on chronic diseases. What are our plans for the future? There are plans. We are not perfect in Finland. We have a lot of to do and a lot of to develop still. So, for example, more systematic support for implementation of best practices is something which we need to know. We need to do better than nowadays. Use all tools. For example, our National Institute for Health and Wellbeing has a key role there. And also we are just now, or the National Institute is developing a best practices portal. It's a pilot project which could be in the future also supporting the activities on local level and regional level, and because we don't have that such kind of portal not yet. But there's still a lot of to do and still have a lot of to learn from each other, which CHRODIS Plus have offered us. And I think the phrase which was in the top of a program of CHRODIS Plus conference is something which we all should keep in mind. That's very wise to say that we can make Europeans happier, healthier, and more active by implementing good practices. There's a lot of to do, but there's a good start and a lot of good activities which should be continued also in the future. So thank you. That was what I wanted to present from Finland for this beginning of this conference.